patient comes.
Hello, good evening, everybody, and thank you, Dr. Mukesh Porwal, sir, in particular, and Alembic people. Thank you all for joining. My topic today, before the patient comes, and on how to go about in the COVID-19 pandemic. Now, these are unprecedented times, as we know, and as the date is, many of us have shut down their OPD. Now, I don't know how many of you have, started back, but I have not started back as of yet. Just a little disclaimer, because the guidelines are rapidly changing, and the scientific knowledge into the disease is also constantly changing. So we really don't know the guidelines what stand today might be changed tomorrow. Now, like as we also know that the global load of the virus itself is so high that even the best of the healthcare have not been able to sustain the contain the virus and the population which is spreading therefrom. Added to that, our local so there is some. Is my slides visible to you?
Yeah.
Yeah, visible.
Yeah, it is visible.
Slides are not moving.
Is it? Yeah, only one part of that global part is visible.
Yeah, that's what. Next slide is not coming up.
So just click on the slide and start.
Message करो एक आई करेंगे પછી પાછળ ચાલુ કરે ને
Hello.
ग्राम से भाई बुरा को फोन करो मैसेज करो तो आप लाइक कर दो પછી અહીંથી
Sir, just click on your slide and next button. Sir, please press F5. F5, please.
Yeah.
આવું આપણે ધૂળેટી માં નથી રમતા
So again, the Indian load is increasing day by day, and what this is 15,000 has now increased to 20,000. Even in Rajkot itself, we have 40 cases, if you are believed to the Gujarat today daily. And so all of us are in. Can you have the other speakers off, please?
Can you mute everybody else?
Okay. So, like, we need to change ourselves right from the get-go, right from arranging an appointment to the examination of the patients. So, what hold today, what we assume are not going to be, like, it's not going to work the way we are working, going backwards. So my computer has an issue.
Yeah, you can, Dr. Akash, you can just keep speaking your points, whether the picture comes or not.
Yeah, so we'll have to change the way we take payments from our patients, the way we schedule our appointments. Some of the methods like direct ophthalmoscopy might have to be discarded at least for some time. Architecture of our hospital, the way we dress and attire in our clinics, training of the staff will have to do quite a bit, and we also need to protect ourselves medico-legally at the same time, because these are unprecedented times, and we have seen day in and day out patients making allegations. Second point of thing is, suppose should we come in contact with any of the patients, then what happens is, if any of the patients turn positive, they seal our hospital and keep us in quarantine. And God forbid, should we they don't allow even relatives to even see us last. So the coronavirus introduction has been dealt with other speakers, and the symptoms, as we all know, are fever, cough, and shortness of breath. So this needs to be taught to the receptionist, and they can triage the patient at the receptionist level itself. So this the basics of coronavirus should be known to each and every of our staff. So that system is a must. Right from the appointment scheduling, because most of us would be either resorting to tele-ophthalmology, especially anterior segment surgeons who can afford to retina specialist can, but anterior segment surgeons who can afford to go by tele-ophthalmology consulting should go. The emergency cases are only supposed to be seen. Non-emergency cases are preferably deferred because of the same reasons and more. And you can whenever you ask them to seek an appointment, just tell them to be on time, specific time that you should be coming down to a clinic at 10 a.m., 10:30 a.m. So you see them slot wise, and also you give them a set of instruction that your Aadhaar card also would be needed, and just bring one of the relatives with you. Don't flock patients together whenever you come just for a simple eye emergency. Now, if the patient is COVID positive and is a known COVID patient, then you don't see him in your clinic at all. You call him in a multi-speciality hospital. You don the entire COVID PPE kit, and it's then only that you examine that patient. Second point of the after the patient has obtained his appointment and when he enters the hospital, there we need to make certain precautions, because we don't usually use the main door. If the hospital has two doors, then we use preferably the side door, which is more for emergency patients. And even while they are sitting outside the hospitals, you don't flock the patients inside your even the OPD, this thing. So even while they are sitting outside the hospitals, you ask them to maintain you place those chairs at 1 meter distance, and then you make them safe.
Yeah, Akash, first, before they actually enter the hospital, 1 or 2 points of the extreme importance, that on the phone they have to be instructed to wear a mask, and certain precautions has to be taken. If you can highlight those, then it will be useful.
I'll be next slide. The first point of contact, he is a very important person. So he is usually either the person who is who's managing our OPD, or he could be even the the security guard. So at least he should be wearing a cap, a mask. Here I've shown a cotton cap, but ideally he should be wearing those 3-ply masks and caps, and he should also be wearing the disposable gown. And we need to train these people to wear all these things. And he should have a thermal screening apparatus with him. Now he screens for the fever directly, and whether if the patient is found to be positive, is found to be feverish, we don't let him enter our hospital. We ask him to visit a physician, and he undergoes SOS code testing if the physician deems proper, and he then notifies the authorities, because COVID is a notifiable disease. Now, after they have entered and before the primary workup is going on, there are certain things which we need to ask the patients. Ideally, nobody goes out nowadays without the mask, as we see on the roads, but they should be coming with the mask. But if suppose the patient has walked in with some, say, whatever eye emergency problem he has, is suppose driving on road and met with an accident or something like that, and he drops into it, is first given the sanitizer, and then he wears the 3-ply mask, which is given. That should be supplied even from us, so we should have stock for them as well. The simple 3-ply mask and a cap, and those set of instructions which are to be followed. They need to be on the display board of the hospital, what all social distancing and the norms are there for the hospital. Again, in the hospital also we leave one chair ahead. If it's a small hospital, it's a small time clinic, we leave one chair and then make the patient sit on the third chair. And so on. Ideally, a 1 meter distance would be advisable, and not clustering of the cases. Most ideally, not more than 3 cases per hour. That is 20 minutes per patient, and not more than 3 patients per hour is how it should be. The schedule. Even the nurse, she doesn't wear this routine attire which she wears. She wears those surgical mask and the gown, and she wears the 3-ply mask. Preferably N95 if they are available, but by and large they are not mandatory for her. Informed consent is a must in COVID era. Many of people falter here. AIS is given a nice yesterday itself they have given a nice informed consent, so everybody should take a printout and obtain an informed consent, because the patient might allegate tomorrow that I got COVID because of you or your negligence, and then you might be into a fix. So an informed consent becomes mandatory. Home dilatation is preferably advised for those cases who are diagnosed. Say an anterior segment surgeon sees and he refers to me, I would rather suggest the anterior segment surgeon to prescribe those Trophic Acid Plus or whatever eye drops are there for the patient, and the patient puts them at the desired time, half an hour and 1 hour before, and approaches the hospital. This would prevent the clustering of the cases when they approach to us. And secondly, that will allow also us to like have a minimal contact. If the patients are supposed to be related in our hospitals, a separate bottle should be used for each and every patient, and in between the patients also you should be using hand sanitizer frequently. So that is how it goes with the dilating of the patients till the patient is not in touch with us. He's just we are triaging the patients out. We are in the top of the pyramid. So if should the patient be that of a red eye and
Dr. Akash, we'll have to stop here because the time is up, but we'll discuss one or 2 points before the patient comes. Okay, there was a question whether Aadhaar card is compulsory for all OPD patients or only for the surgical patients. Now,
no, Aadhaar card would be compulsory in the sense, because suppose if the patient turns positive, and if we don't notify the authorities, and whenever the authorities want us to the details, we should ideally be maintaining a separate register altogether.
Right.
So
what I would suggest,
mention the verifiable phone number as well as the verified Aadhaar card as a copy as well. So the Aadhaar card details would be compulsory in that sense.
Right. What we practically do is when we take the corona consent, then we write the patient's name and all the relatives who are there with the patients, their name and all the phone numbers. Aadhaar card for everybody may be difficult, but if you have phone number contact of all the patients, and this should be randomly verified that they are giving the right phone numbers or not. Exactly. That should be adequate. If the Aadhaar card may be a bit too much, but you should actually have the name and number of every patient and every relative entering the hospital. That is the must.
Like a separate register recommended.
Sometimes patients may not reveal their correct address. For that, at least Aadhaar card should be seen by your receptionist. They may not really take a Xerox copy.
Like,
but at least
how do you know that the patient is from Zangleshwar or not? Suppose if the patient is from
something
a very
like that.
High, a very high hotspot zone, we really don't know how to triage them at the before the patient approaches us. So
that is why the next talk will tell us how to take precautions, right? So another point I would like to make here is encourage your staff and all the patients who come to install the Arogya Setu app in their phones. That will give us a lot of information and also give them education and a lot of awareness about the disease. And it will be easy to trace. And you can always ask them to show the Arogya Setu app, and whether it is in the green, if it shows safe, then you are relatively safe. Because the Arogya Setu app will have the information of the patient also. Right. So you will need
Can
to
I
spend
ask
yes.
Question? COVID.
Yes, please.
In the previous AIOS webinars, one of the legal experts they are invited, and he told that the COVID consent will not legally protect you if somebody sues you. I just wanted some clarification on that, and still, what is the whole point of taking the COVID consent when one can't prove in court that the infection will be acquired or is acquired from the hospital or not?
Yeah, it is not from the legal standpoint, I would say. It is imparting information to the patient that this is the COVID era and there is a risk of infection from patient to the staff and hospital people, and vice versa also. And also we use that consent form to record the names and numbers of all the people with the patient. So you need some sort of paper or document. We use this to collect information about the patient.
The patient has your prescription, number one thing. So, and the prescription mentions the date. So you have seen him on so and so day. Now, after 5 days, if he turns positive, and if he alleges that I got, infection from you, and if you don't have any basis,
he cannot allege. He cannot allege under the epidemic law 1887. He cannot allege. Pandemic means that it is an epidemic which is across the country. It is very difficult for anybody to find out from where he got it. So he cannot allege. That is what was the medical legal point of view. Yeah. Nobody can allege. We also cannot allege that he has given it to us.
Yes. And also the supreme body of ophthalmology in India, the All India Ophthalmic Society, has asked us to take a special consent. So it is better on that side to take the consent.
Otherwise, also a consent, like 99% of us people don't do, but otherwise also before checking any OPD patients, consent is a must. So like otherwise also consent is a must.
We'll stick to this specific situation, and I think these 2 points about the patient getting Arogya Setu app in the phone and having the phone numbers, preferably Aadhaar IDs of the patients in the hospital recorded, that will be a great idea. And appointments on phone, spacing them apart as much as possible. Now, can you please share the next speaker's screen, please? I think Akash will discuss your other slides when the time permits later on.
I think that was a jumble up. I thought that
Yeah, I know. Yeah. Can you please make Dr. Hemal